Good afternoon. I'm Dr. Anthony Cristillo, Digital Health Partner at Guidehouse. Welcome to CDO Magazine's podcast series. Today, I have the distinct pleasure of chatting with Dr. Stuart Knechtle. Good afternoon, Dr. Knechtle.
Good afternoon, Dr. Cristillo.
My question lies in the fact that how does one pivot towards that future reality while continuing to keep the trains running? It, unlike a lot of sort of advanced, um, uh, I'll say advancements, modernizations in different systems and platforms, um, the organ transplant network as a whole needs to continue. It needs to,
Yes.
the trains need to keep running. And so what is sort of your thoughts around how do we keep those trains running and at the same time help to advance that modernization in some of the sort of new discoveries as well as improved logistics and patient outcomes that you're speaking of?
Well, I think you're putting your finger on a sensitivity in the transplant community because there's been anxiety over changing the system. Because in reality, although the current system is far less than perfect, it does work. We are doing a lot of transplants every year, on the order of 36,000 last year. And so it's an anxiety that if we make a change, that we might stop the gears from moving and then in that way hurt patients. So I think one potential way to think about this is that change is going to be incremental. And if we built a system that allowed it to be test piloted in particular regions before it's rolled out across the country, that might be a strategy that would allow us to check quality before jumping all the way in with both feet. So I think building a platform that can be modeled, for instance, in the Southeast, or you pick a state or two, or maybe several states to test out your system to make sure that it is functional and beneficial before putting all of your eggs in that basket. And I think if we build a system that allows testing locally, that would be a huge advantage. This is not a novel concept. It's been discussed before and seldom tried and implemented. But again, I think the current IT tools that we have available to us lend themselves to that type of a system.
That's excellent. I want to go down that path of now that you've opened up sort of that thought of tools. I think many of us in the health technology space continue to think of how to best leverage artificial intelligence, machine learning, advanced analytics. You touched on a few of these concepts in the context of the data. Could we speak a little bit more about technology and the tools themselves and the types of questions that such technology or advancement in technology, where that could bring us in the context of organ transplantation?
Well, thank you. We currently use a very manual system now to match donors and recipients in organ transplantation. There is a donor coordinator who communicates information about the organ donor to an on-call physician, generally, often a surgeon, who has to evaluate the quality of that organ and then review the patient that it's being offered to and see, is this a reasonable match with this patient? And after reviewing all of that donor information and all the recipient information and then communicating with a recipient coordinator about the suitability or lack of suitability of that organ, they then either accept or reject that organ. So that process is highly repetitive behavior, of course. If you're the on-call surgeon, you get multiple calls a day. If you're on the on-call coordinator, you're dealing with dozens of organ offers. And of course, you have hundreds, if not thousands, of patients on your wait list. The promise of AI is that it could look at a particular physician or at a particular transplant center, and it will have all of the acceptance data and all of the evaluation data of the last 500 or 1,000 or whatever number you choose to see all of that data, all of the data on the recipient, and to see what is the behavior of that transplant. Suppose it's myself. What organs does Dr. Knechtle accept for this kind of recipient? I'm sure that my behavior is fairly stereotyped, but an AI program could improve on Stuart Knechtle's behavior because I'm not the same person exactly from day to day or from week to week. My decision making is often influenced by the last dozen or so transplants that I've done. If I had an unfortunate outcome, I may be overly influenced by that. Or if I've been lucky, I may be over influenced by that lucky decision and so forth. Or AI offers the opportunity to standardize behavior across surgeons at a particular program, and it allows you to look at bad decisions you've made and how could you improve on those. So I think it's a tremendous quality improvement tool, and it could be used to reduce the number of hours that are now required by surgeons and transplant coordinators to match donors and recipients, just as an example, because the reality is this is highly repetitive decision making and behavior, and an intelligent AI tool could put all of those thousands of factors together and probably provide a very reliable solution that probably should be still subject to a physician's judgment. You don't want to force a surgeon, you don't want to tell the surgeon you must transplant this kidney, but you could say that this organ has been transplanted at your center successfully by you, 150 times previously. So it's probably a pretty good bet that you should use this organ.
What strikes me by your responses, you brought in how technology can bring a level of objectivity to the mix, how it can remove bias, even unintentional bias, which is a fascinating area that many of us potentially overlook. The influence of the last dozen or 24 experiences and how that influences the next decision we make. And I love your responses that are very focused around that decision making. I imagine within the organ transplant environment, network as a whole, there's a vast amount of decision making that gets done, from daily operations and workflow that you alluded to also a level of connectivity and communication with families, with donor families, with surgeons, with transplant coordinators, different institutions. I think your arguments or your discussion around the value of these tools and the data lends themselves to optimization, operational improvement in those areas as well. Is that accurate? Would these tools also help in that context?
Yes, I think you're pointing to the value of a better communication tool that could be accessed by multiple parties, such as referring physicians, patients, families, coordinators, physicians, insurance companies, and so forth, to see how is this process working, and to take it out of the mysterious and
Right.
make it more transparent. It would probably be a big advantage in terms of accurate communication.
I seem to think that with technology, we begin this new era of transparency. Many can look at the internet and gain insight through different sources of information, insight into disease and as well as different conditions and treatment options. So that's sort of my line of questioning is, does this open the door for a greater transparency among patients as well as the providers? It sounds like it does.
I would hope so. And we certainly need to improve the level of trust, particularly in some sectors of our patient population where there has been a breakdown of trust in some communities. And so to have consistent, transparent data available is at least one step in helping to restore trust.
I want to kind of tie this together with a couple of another question that you started down this path of helping to helping me to understand that the data would be tied beautifully with analytics that would help to inform decision making and a better patient outcome. You raised the point about patient equity. The data and the tools, do we imagine that they will provide greater insight into the specifics around that equity, or at times lack of equity, and approaches to improve the situation? And so one can imagine that data has this wonderful ability to help you understand if certain populations are not brought to the table with respect to, in the case of organ transplantation. But could it differ? Could it differ in different regions of the United States, different states, rural communities, different groups? And could these tools then provide that kind of insight for you?
Yeah, I think these tools could be a huge advantage, for instance, in reducing the organ discard rate. The difficult decisions that we make in terms of whether to accept an organ or not have to do with these non-ideal donors, where you're offered an organ that is not, young and perfect, but it may be good enough to get a patient off of dialysis for several years. Well, it would be helpful to have data in your system that could identify patients who, under the current allocation scheme, are very unlikely to ever get a better quality organ than that. It would be helpful if the patients could be educated to understand that, so that they don't refuse to get such a kidney, and that the surgeon could be educated to know that this kidney will actually be good enough to do well and keep, Mr. Jones off of dialysis for 3 or 4 years. That may be that's a different decision-making tree than you would apply to an 18-year-old patient who probably deserves the best quality kidney available. But maybe if you have a 70-year-old patient on the wait list who's a common blood type and who has a very low chance of getting a kidney anytime in the next 3 to 4 years, and that might be an excellent kidney for that patient and offer them a chance to get off of dialysis. So I think this type of more granular and finessed data could go a long ways toward giving us information that informs that decision and then helps educate both the surgeon allocating that organ and the patient as to why they should accept it.
Thank you. To tie things up, I think we've had a wonderful discussion today. You've really provided us great insight into the data that exists that we could expand upon for greater insights into improved patient outcomes, into clinical decision makings to achieve those improved outcomes, and what phenomenal insights into the needs that exist and improved operations across the network. I think you've given us a lot to think about in terms of the challenges and opportunities that exist And so I just wanted to thank you for spending time with us today and educating us. Appreciate
My
it.
pleasure, Tony, and thank you for your partnership in these efforts.
Thank you.